All right, so now, guys, thank you for coming, showing up. I'd like to thank you guys for spending your Wednesday night with me, but also congratulate you on taking the first step to building a resilient body joint by joint. So this is resilient knees and how to get them. Today we're going to be going over the knee joint, our first joint in the Resilient Body Workshop series. All right, this workshop is for you if you have knee pain, squatting with stairs, and you want to get rid of it, right? You have stiff and achy knees, or you don't have any knee pain and want to keep it that way, or you want to improve your ability to perform in sport, in all your recreational activities, whether or not you be a golfer, a CrossFitter, power lifter, runner, doesn't matter. Everybody's got knees. You're all human. All right, so some things that you're going to be learning tonight, right? The key things to do right now so you can reduce knee pain. When a knee problem isn't a knee problem. I see this a lot with my clients that come in to see me, that they complain that I have a knee issue, but as you'll see tonight, the knee is a very simple joint. That problem could be something else. And then self-care must-haves. All right, what's in it for you? You guys are hanging out with me tonight. You're going to speed up your recovery. You're going to reduce your post-workout soreness, and you're going to reduce your risk of injury. All right, so an important note also to eliminate pain, but an important note that this is not physical therapy. All right, this is not medical advice, right? This is something that is targeted to a broader population, a broader audience, with general tips on what you could do to address knee pain. For specific things, I would suggest that you contact me where we can develop a customized assessment and treatment plan to get to the root cause of your specific dysfunction. I basically take, for this webinar series, I basically took a lot of the common things that I would say to clients and patients that I've seen over the years. If they've had knee pain or if they've had some type of joint pain, I would always say this one or two things. I tried to sum it up and make sure that I could fit it in this 30-minute time block for you guys. So I know you guys, your schedule is busy. All right, so if you stay to the end though, special for you guys attending live, if you stay till the end, I'm going to give you a special discount on Rock Floss. I'm going to show you how to use it. So this is one of the things that I found to be very, very helpful and very useful for people that I've seen with knee issues. And Rock Floss is a really game changer. And I'll show you what I mean by that. So I'm going to stop the live stream for Facebook, and then we could talk more intimately. All right, so who is this guy? Who are you? Well, my name is Dr. Paul Kachoa. I've been in the physical therapy field for over 20 years. I got my doctorate back in 2010. I'm an owner of Par 5 Physical Therapy. My purpose, my goal in life is to help active adults move better, feel better, and play better so that they can get back to doing what they love to do without pain meds, injections, or surgery. That's my goal. All right, so now let's dive in. What are we going to cover tonight? Well, we're going to cover the little known truth about knee problems, 3 stretches to help improve your knee health and why we're going to do them, and some mobility must-haves to maintain the above stuff without undoing them. And I think we're going to cover a lot of postures and positions that we assume throughout the day that typically can lead to knee pain. It's these things that you do without even thinking about it. All right, so stretches of mobility, a little bit of a note of this. 1, never push through the pain, all right? So if we're going into a stretch, don't push too hard. We want to hold these stretches over a longer period of time, gentle, and you combine that with what you do throughout the day. You know, whether you be sitting, reading, working, whatever it is, try and include them to do these stretches more frequently to really make long-lasting adaptive changes to your body. All right, so the truth about knee pain. Got a little video here about how the body functions, right? The body functions on an alternating pattern of stability and mobility. If that pattern is disrupted, then all you get is pain or injury, right? So if we look at the knee on this picture here, the knee is classified as a stable joint, and that is bookmarked by a mobile hip and a mobile ankle. So like I said before, the knee is a very simple joint. All it does is really bend and straighten. Just bend and straighten, flex and extend. When people run into knee issues, I look at how the hip is moving and how the ankle is moving. And that, if that movement is dysfunctional, then that can lead to knee issues. So the next thing are 3 tests that I want to go over. You probably do these already, probably have done them already. The squat test, the hip flexion test, or the hip flexor test, and the knee flexion test. So we're going to look at how you could squat. So this is a picture of a squat. It's basically putting your feet about shoulder width apart and squatting down. Now we could do this now, all right? Because after we get done the next couple slides, where we're gonna address tissue mobility and joint mobility, we could try the squat test again and see if there is a change. So if you're dealing with pain, go ahead, stand up. If you're sitting down, get into a squat, right? So what we're looking for when we do this squat, I'm gonna put my camera down so you can see, is we've got our feet about shoulder width apart. Ideally, the feet are pointed straight. So if you're already starting your squat with your feet out like that, that's a no-go, right? So we like to be maybe at the most 10 degrees turned out, at the most. So we're here, equal weight bearing between the ball of the foot and the heel, and then we're gonna squat down. And what happens, can we get the hip below the knee, right, with an upright trunk? Can we stay balanced? Are you falling forward or falling backward? And those are the things that we want to check out when we do this squat test, all right? The next one is going to be the knee flexion test. Basically looking at physiologically, you should be able to bring your heel to your butt, right? So if we're looking at that, you should be able to get down into this child's pose position in a weight-bearing position and then get your butt to your heel. Or if you are lying on your back, let's see if I've got enough mic room. You know, by the way, please somebody put in the chat room or something that you can hear me okay. Just to double check, because I don't want to get through these slides and go like halfway through and then nobody can hear me. So please, somebody type in the chat there and say yes or okay if you can hear me. Excellent. Thank you, guys. Thank you. I knew I wasn't just talking to the ether, the internet. So anyway, the knee flexion test. Typically, we do this in that child's pose position, or we can get down on your back and pull the knee into your chest. Again, we're looking for that heel to butt. This is physiologically what you should be able to do. If you're having pain with that, which is more common with knee osteoarthritis or patellofemoral issues, then we've got something for that as well. All right. And then next, the hip flexor test. I'm going to tell you that I'm going to say like 80% of the people that I see in my clinic, they fail this test. All right. So you're going to get at the edge of a bed, edge of a table, right? If it's your coffee table, fine, right? Just don't break it. And you're going to sit down at the end, pull both of your knees into your chest, and then let one leg go. All right, so it looks like this. You can see me. We're gonna be sitting like right on the edge. My feet are still on the ground. I don't wanna be totally back on the table. I'm just gonna sit right on the edge, and then I'm gonna pull both knees into my chest. When I'm here, what happens is that it flexes my hip and flattens my back. And from this position, I'm gonna hold my right knee in that position. We wanna get nice and tight. And then I'm gonna let that left knee go. As I let that go, I'm going to feel where does that go? Does it go totally flat? Does it go straight? Does it go out to the side? Or is it up? I'm going to show you on this other side. So I'm going to show you here. If I let this one go, can it be bent? Can the knee be bent 90 degrees and the thigh parallel to the ground? A lot of times I'll see is people will be a little bit less parallel, be straight, they can't bend the knee, or the knee's out to the side. So if your thigh does not go parallel and you have a 90-degree bend, that means that either A, your hip flexor, your rectus femoris, or the iliopsoas, all the muscles in the front part of the hip, one of those is tight. Or sometimes it's a TFL, and we'll talk a little bit more about that later. So those are the 3 tests. Can you bend your knee? Can you squat? And then can you do this hip flexor test? So those are the 3 things that I typically see are a problem with somebody with knee pain. All right, the quality of the squat, how much they can bend the knee, and are their hip flexors flexible? So what do? This is a hip flexor stretch. All right, this is one of the key things that a lot of people have a hard time doing. I'm going to hit play on this video. Thought it would auto play. Got some music, right? If you guys follow me on Instagram or Facebook, you probably have seen this video before. This is the proper way on how to do a hip flexor stretch. The only way for a muscle to be stretched is if both attachment points, the origin and the insertion, are stable, right? So if I'm going to pull a muscle and I'm going to pull one end, if I don't keep this stable, it's just going to come along. And people will end up looking or searching for a stretch. If we stabilize the back, the glute, the pelvis, and we do this type of movement where it's very focused, you should feel the stretch earlier in the move than if you let the belly go loose, if you let the belly button come out and then just arch your back. So you could try that now. You get down on the floor and see how that goes. This is typically what I prescribe to somebody who does have knee pain. So you could see this from the side view, but from the front view, the key points of technique are going to be making sure that your shoulder, your hip, and your knee are completely in line. You cannot have that knee or that hip out of alignment. It has to be totally straight. The more that you can contract that abdominal muscle, contract those abs, keep the ribs down, and contract the glute, that really stabilizes the 2 ends of your pelvis or the hip flexor, so that when you do move the pelvis, it becomes a much more effective stretch. All right? So type in yes if you are doing that, if you're adventurous and trying some of these things at home right now or wherever you are. All right, let me know. Excellent, Carla. Great student, great patient. All right, so here we go. Next one, the knee flexion stretch. Oh, let me get this back. The knee flexion stretch. So if you have an issue with trying to bend your knee, think about this. The knee is a hinge joint. So when we close that hinge and you have pain, you basically have this joint surfaces moving on one another. If we can create a gap or some space in between those joint surfaces and have you do that move, then you should kind of facilitate the bending. So I thought I had these set up to be autoplay, but technology, right? So here you go. So you're sitting, you're pulling your shin, your heel into your butt, but the key thing is putting something, a towel roll, right behind the knee. You could do this in a kneeling position. That towel roll in between the knee there, between the calf and the hamstring, just creates a fulcrum to create more gapping in the knee joint as you bend in a sitting position or a kneeling position. All right? If you're having problems with the bottom of your squat, bottom of your snatch, that squatting position, and you want to improve that and free up that knee joint to bend more, this is one of the go-to things that I would do. There's also drills that you could use, the super bands, like the Spanish squat. That's one that kind of helps, you know, move that joint in the correct way to improve that knee bending. All right, the next one, we're going to talk about the TFL. The TFL self-release, I think, is one of the go-to things that if you're having especially lateral knee pain, that tensor fascia lata muscle tends to get tight in a lot of people. It's part of the iliotibial band. If the glute, say for example, and we might even cover this later on in a couple of weeks when we do the hip, but if you sit a lot and your glute or your hip flexor is tight, it will inhibit the ability for the glute, the muscle on the other side of the hip, to fire, the gluteus medius mostly, And then if that gluteus medius is inhibited, then that puts more stress on this tensor fascia lata. The tensor fascia lata is very happy to try and be the fake gluteus medius, right? Just kicking the leg out to the side or standing on one leg. If you're a runner, this thing is on all the time, the IT band, right? So before I go into how to mobilize that tensor fascia lata, let's look at this picture. This is an engine, right? Ferrari engine. Now, you think of our body as being a very complex machine. The engine is probably, you know, as complex as humans can get at this point, right? But as a human being, our body is the most complex machine on Earth, right? And if we think about the engine and saying, all right, when we run the engine really, really hard, a high performance vehicle, there's going to be exhaust, right? There's going to be waste product in our body. There's waste product. There's cellular waste product. You can call it lactic acid. You can call it a change in the pH of the muscle. But whatever it is, it contributes to the soreness that you get after the workout. So also, if you follow me on Instagram, you probably have seen this before. I dropped hints on what do grapefruit and lemons and oranges, what do they have to do with a resilient body? Well, I'll tell you what. The white stuff that is in between the meat of the grapefruit, the orange, the lime, is analogous to our body's fascia. And our fascia is this connective tissue that fills everything. It gives our body its shape. If we didn't have fascia in our muscles, holding it all together, we'd just be hamburger meat, right? So let's take a closer look. Inside a muscle, the muscle is covered on the outside, on the inside, everything. That fascia fills in all the spaces. It even connects and forms the tendon. All right, so this fascia allows tension and force and torque to transmit from the muscle belly as it contracts into the joint and then into the body as we move. So if we look at the whole body, we have these fascial lines that they work together. The fascial lines are totally connected. If you were going to do a dissection on somebody, you would be able to dissect this continuous line, like that first picture, first skeleton on the left. That's the anterior fascial line, all the way from the front part of your foot, ankle, knee, hip, all the way to the bottom part of your chin. So all of that is connected. So if we're going to do something to address the knee, we might not have to address just the knee. If I rolled out, say, the front part of my hip or the abdominal area, I'll free up that anterior chain higher on the chain, and which may affect the ability for the lower half to be mobile or stretchy, right? So back to the tensor fascia lata. The other thing I want to say is the iliotibial band is super dense. It's super strong. It cannot be stretched. If you roll it out, you are not deforming the IT band, right? What do you do when you roll that? It's a big question that I get asked. Well, if you do roll that IT band, you're not deforming that tissue. You're creating a shearing so that the lateral hamstring and the lateral quadricep can slide underneath that IT band. And also you create these pressure gradients as well to move around fluid. But the IT band is so durable, so strong that you can't really deform it. You can't lengthen it, basically, right? You can't make your IT band longer. It's impossible. All right, so another picture about how everything relates to the lateral knee. Localized pain in the outer knee. I always look at IT band TFL, tensor fascia lata muscle. And also gluteus medius weakness. So how do we do a self-release? You could use a foam roller or a lacrosse ball, right? So, but when we want to improve mobility in a piece of tissue, we have to include some type of shearing force. The body isn't just about elongating point A to point B, making things longer. We have to let things slide as one thing shortens or one thing lengthens underneath. That shearing force is what we need to do with a foam roller or with a lacrosse ball. So the lacrosse ball, this is how they put it, like right into the TFL. It's like right into the front pocket, just in front of the hip joint. And you lay down on it, you know, so that'll make it, that's very common. All right, so those are the two things that I would suggest. If you're at home, and this will go and for the rest of the workshop series, webinar series, is that you definitely need a foam roller and a lacrosse ball. You need 3 lacrosse balls at the very least to take care of your own body, because everybody should be able to mobilize and maintain their own body, right? It's sort of like back to the car analogy. If you have a vehicle, you should be able to know how to put gas in the car, gas in the tank, and air in the tires, right? Very simple things. But if you have something going on underneath the engine, if you have to look underneath the hood, you take it to an expert, unless you're really good at that, right? Unless you're the expert itself. So simple things like maintaining your own body, I want you to be able to do, right? That's my goal to try and include in this webinar series, that people should be able to do the things that they, that they can do to maintain themselves. If they need a specialist, they come in and see me. All right, so the only other thing too is that we need to reduce tone. A muscle will only relax if your brain allows it to. So if you're gonna do this foam rolling and you are, holding your breath, squeezing your face, gritting it because it hurts so much, then that muscle is not gonna release. You have to work on your breathing, make your exhalation longer than your inhalation, relax your face, and work on that breathing to allow that muscle to relax. Now it autoplays, there you go. So these are a couple techniques to get into that TFL. This guy gets onto a ball, he puts it in that pocket area. I like to start with the knee and hip bent a little bit when you get onto that ball, because a slack TFL, when you have slack in it, it will tolerate the pressure more, and then gradually you can start to extend and straighten the hip and knee, and then that will give you the stretch and that shearing force, which can create some permanent change in that tissue. All right, and anytime that you're doing some type of soft tissue work, I would suggest at least 2 minutes. That's about the time that you're allowed, that the body can relax and allow that tissue to elongate, really. The other thing with any stretches, like that hip flexor stretch, 30 seconds is going to be the bare minimum that you're going to hold that stretch. Anything less than a 30-second stretch, a sustained stretch, like that hip flexor stretch, that tight tissue just kind of snaps back, just rebounds into a shortened position. All right, so we talked about shear force. Shear force with a band is using this compressive band to create an external glide or an internal glide. And the Rock Tape, Rock Floss, or the Rogue Voodoo Band are 2 that I've been using that I find that are really, really helpful. So if you take the band and you go about 50% overlap with a 50% stretch, you put it over the area of your body that is tight, where you have the pain, or you feel there's like a little trigger point, and then you move. Either you'll move the tissue with the band on it, sliding the band when it's slacked around there and then rotating the muscle, or you do what this person is doing. You're doing an active motion. You're bending and straightening the knee, either in sitting or in a squat position. So what you're doing is you're creating this compression of tissue, and then moving the tissue underneath, which creates this shearing. And I find that this is like a game changer. Then you could, follow it up with tape. But, those are things that probably give you the biggest bang for your buck. All right. So if you've been following along, trying to do some soft tissue work, or a hip flexor stretch, or a squat, or the knee flexion mobilization, you can repeat these tests. Squat test, knee flexion test. Can you get your heel to your butt? Can you hang off the side of the table with a little bit more flexibility in your hip flexor? Those are things. The one thing that I always do in clinic is that we're going to do a test, do a movement that's painful, do an intervention, and then recheck that movement that was painful. If it doesn't feel if you don't feel like there's a difference, then the thing that we didn't work. We always want to make sure that there is a concrete change in your ability to move or your pain level after any type of intervention. All right. So just to recap, really, really quick, wanted to condense this into a 30-minute webinar for the first day, just so that I don't want to take up a lot of people's time. But what we went over is the hip flexor stretch, half kneeling, 30-second hold. That knee flexion joint mobilization, roll up a towel, pull your heel into your butt, either into a sitting position or a kneeling position. And the TFL soft tissue release with either a foam roll or a lacrosse ball. All right, foam roller, lacrosse ball. All right, and then a compression band. Now, the good thing is that for you guys that are attending live, this is the special discount. So the 4-inch rock floss, let me go grab mine. This is a 4-inch rock floss. It's larger than the 2-incher. Now I think that the 2-incher, if we're gonna do an elbow or a shoulder, works well, but the 4-incher, because we have thigh, we have knee, tends to work well, I found, on the lower body, the leg. If we're gonna do an ankle, I would go with the 2-incher. But regular price of this is $36, and you know, the workshop discount I'm gonna offer today is gonna be $20. If you guys want one of these, either put something in the chat or text or email me or something. Let me know if you want one of these for $20. It's like you know, $16 off. It's basically the price that I pay. I have to pay like shipping and handling too. So let me know. All right. So now, if you are already in pain though, like I mentioned before, you know, we should probably get you in to see me, right? So I mentioned this, if I didn't mention it already, I always give a free consultation, right? To people that don't know me and then think like, oh, you know, what's this guy? Who is this dude? And will he help me? So I always offer a free consultation. It's not really an evaluation, but you know, it's 30 minutes long. It's not a creation of a full treatment plan, but we have a deeper conversation about what your knee problem is, what it limits you in doing, and if it's something that I could fix and if it would be a good fit. That way you can make an informed decision rather than going in blind. If you want one of those, you can, you know, kind of put something in the chat box to request one, or you can call or email me at the number and email there. Now, these are some things that people have said about me online in the past, you know, some past clients. You know, I hope that those people can give you a good insight of like what happens behind the scenes. So anyway, as a workshop series, right, so these next 6 weeks, my goals were, you know, to be able to relieve you of aches and pains, you know, get rid of the pains, no more stiffness, less injuries, so that you can basically enjoy your time with your family and be more resilient and confident. Now, this is pretty much where I'm going to wrap things up, keep this under 30 minutes. Now, for the people that are still watching, the big question that I want to ask of you right now is, would you want a longer workshop? All right. So generally, I try and make these things an hour, but for this, for the time and the online and, you know, things are going on right now, I wanted to make it 30 minutes to try and be as concise as possible. Okay. So let me know if you want to make something longer, or if you want something that you want me to cover. If you have a question, please put in the chat room or the Q&A box. All right. But basically, now's the time to ask me if you have any questions. All righty.